Florida for 5 minutes for questions.
Thank you, Mr. Chairman, and I thank you for allowing me to sit in on the subcommittee. Secretary Gadlick, does the hospital preparedness program currently allow states to use grant funds to help defray costs associated with procurement and maintenance of generators for assisted living facilities and skilled nursing facilities to support the development and sustainment of regional healthcare coalitions?
So the way the grants are structured, it is principally for healthcare facilities and for coalitions thereof. So as part of a plan of a coalition, that could be considered as part of it, but we don't dictate that as being part of it. We're looking at to identify how these hospitals and hospital systems can become more resilient. But in fairness to your question, sir, if I may get back to you on that, I can give you a more fulsome follow-up.
Please, that's very important.
Yes, sir.
To see whether it's permissible. Because again, in our area, there are small, nursing facilities, but also ALFs that do not have generators, and that's a priority, and that's what I'm concerned with.
Sir, I'll get back to you.
Maybe they have 10 patients or less, and we've got to make sure they have the generators to back up. Ms. Brandt, last Friday, the committee sent a bipartisan letter to the owner of the rehabilitation center at Hollywood Hills in Florida, raising concerns, again, about the nursing home in Florida, where 14, I'm sure you're aware of this, 14 residents eventually died after the facility lost air conditioning in the wake of Hurricane Irma. There was apparently a fully functional hospital across the street. Unbelievable. And according to the Florida Agency for Healthcare Administration, the facility administrator and medical professionals didn't know to call 911 in an emergency. I can't understand this. What's wrong with these people? How could a nursing home be so unprepared for a medical emergency that 14 residents lost their life, especially when there's a hospital across the street? Can you answer that question, please?
Well, thank you for the question, sir. And as you're aware, Hollywood Hills has been terminated from participation in the Medicare and Medicaid programs. We make patient safety our #1 priority for the residents of all of our Medicare and Medicaid facilities, and this was a complete management failure at Hollywood Hills, which is why they were terminated. They did not meet our conditions of participation for keeping the temperature at a reasonable level. They did not provide adequate care to the patients. As you mentioned, there was a hospital right across the street, which they could have availed them. So they had several levels of what we call immediate jeopardy for patients, which is why they were terminated.
Okay, now who's ultimately responsible for their safety?
In terms of the patient safety, the facility has the responsibility, and the management of the facility has the responsibility to ensure that they are meeting emergency preparedness requirements, that they are providing adequate care to the patients, and we survey and hold the facilities accountable to those requirements.
Okay, that's very important, the accountability, obviously. The supervision is so important. What can CMS do to ensure a tragedy like this never happens again?
Well, one of the things that we have done, as I've mentioned in my opening statement and in the written testimony, is that we have instituted an emergency preparedness rule, which requires that facilities have an emergency preparedness plan, that they train on that plan and make sure all employees are aware of it, and that they have adequate backup in place to allow, you mentioned the discussion of generators and other things, to ensure that they have adequate power supplies and other things to ensure that patient care can be provided, and that they have a plan for where the patients can go if it cannot be provided.
Well, what about Puerto Rico now? I understand that there are nursing homes operating without air conditioning, and people are very unsafe. Who's responsible for this? Who's supervising this? Is it CMS, HHS? And obviously it's unacceptable. Can you respond to that?
Well, so in situations like in Puerto Rico, where you have an almost unheard of position where you have no water, you have no power, you have really no ability to provide it, we work with all of our partners, Dr. Cadillac and the ASPR team, as well as the FEMA teams, and everyone on the ground works with not only federal and state, but also the territory officials in Puerto Rico to pull together to get patients to a safe place. If they don't have the ability to provide that care, then we work together to get them transported to a safer place, such as the evacuees that Dr. Cadillac was talking about earlier from the Virgin Islands.
Thank you very much. I appreciate it, and I'll yield back, Mr. Chairman.
I thank the gentleman for yielding back. Now recognize the